A rare disease has been in the news the last week or so. Superstar singer Justin Bieber is canceling shows because he's being diagnosed with Ramsay Hunt Syndrome.
9 News health expert Dr. Powell Golay is joining us now to talk about this because the name itself is not one that's a really familiar term. So what exactly is it?
You know, and it's pretty rare, and that's the reason most of us are not familiar with it. It doesn't happen all that often, but we get chickenpox as a child. We get over the acute illness. The virus doesn't go away. It actually lives inside our nerves forever, for the rest of our lives. And it reactivates. And if it reactivates somewhere on our skin, it's called shingles. This particular syndrome, Ramsay Hunt Syndrome, is reactivation with involvement of the facial nerve, which causes a very specific distribution where it activates on the face and involves the ear as well.
Yeah, when he posted that on, TikTok and Instagram, I mean, it was kind of jarring to see his face. Almost half of it looked paralyzed. I think a question a lot of folks have, is this contagious?
Yeah, so it is paralyzed. His nerve is so inflamed that it's not working. He also has involvement of the ear, which could affect his hearing. He may also have vesicles or a little rash on his throat, on his palate. So the infection itself, chickenpox, is not contagious. Ramsay Hunt is not contagious, but if he's got vesicles or blisters that are putting out any kind of fluid, those blisters are contagious. Yes, and so until they crossed over, he should not be around anyone who has not had chickenpox. He should not be around pregnant women, and he should be careful being around immunocompromised people.
So when we see that, I mean, you look at it, and first of all, I mean, it's awful for anybody, anyone. But this is his life, like being able to canceling this stuff. What do you do? What do you treat him? What's the long-term prognosis?
So important to get him treated early. So if you get some treatment started, which is like Valtrex, valcyclovir, or acyclovir, those are antivirals that prevent the viral replication. So that chickenpox virus has woken up from the nerves and it's causing inflammation of the nerves. So you want to shut it down with an antiviral to shut that virus off. And then you want to give a steroid like prednisone to actually calm down the inflammation that's already there. And if you start that cocktail early, within 3 days, there's about a 75% chance of recovery. If it's between 4 to 7 days, it's about a 50% chance of full recovery. Wow. And if you wait more than 7, it's only about 30% chance of full recovery.
So would any of us just know right away? I mean, like have a sense, and like it's one of those things you call your doctor as soon as you have a feeling?
Yeah, so you're basically, if you wake up and you see a side of your face drooping, that's an emergency because it could be a stroke, which is much more common than Ramsay Hunt. But it could certainly be Ramsay Hunt if you see any of those vesicles or you see any of those blisters. But much more common, especially as we get older, is actually shingles, And so if you see a rash, and it usually follows the nerve distribution, so it looks kind of like a stripe of a rash on your back, it can be on your leg. It's really, really important to call your doctor as well, because even in those cases, sometimes they use those antivirals.
And there's vaccines for shingles, and they talk about it all the time. It's not necessarily pleasant because it's a 2-dose, right?
It's not too bad. I've heard the second dose can be a little hard, but there's a vaccine for shingles, and more importantly, there's a vaccine for chickenpox. So I wish that was around when I was a kid, because I have a I still have them too, yeah. But you got to get your kids vaccinated for chickenpox, especially, you started at about a year and then follow up a few years later, and if they haven't had it by 13, for sure get them vaccinated. But if you're an adult, and like us, like we've had it, as soon as we turn 50, we got to get that vaccine because it's going to reduce your chance of shingles, reduce your chance of Ramsay Hunt, and any of these complications. Because even in addition to the possibility of his face being paralyzed, his ear being involved, he could even have what's called post-herpetic neuralgia, where there's chronic pain because the nerves get damaged. And those are the nerves that help us feel pain and help us feel sensation.
Yeah, I hate that he's going through this, but plus side is that we're having this conversation because this is all news to me. So thank you for shedding light for sure.